I have basal cell cancer. In fact, I just spent 12 hours, not only 12 hours um, in the doctor's office, three uh, surgeries, three removals of tissue, and 2 hours of surgery on my ear for basal cell cancer. Let me tell you the background of all of this. About 65 years ago, I had acne. Not bad, just normal teenager acne. But my mother took me to a dermatologist to help get rid of the acne. And in those days, this preeminent dermatologist, they used x-ray treatments to get rid of acne. Did they put a lead-lined apron on me? How did they? I don't remember how they treated me. All I know is that the repercussions from having x-ray treatments on acne is that you are left with, in the future, having basal cell or squamish, of having skin cancer, not only skin cancer, but also thyroid cancer, that those are some of the repercussions. And I've had them all. How did we find out about this? I was about 40 years old, went to my dermatologist, can't remember for what, but he looked at my skin and he looked at one of the things on my skin and he said, I think that's a basal cell cancer. And I didn't know, I don't know what I knew at the time, but he sent me to a plastic surgeon whose specialty was plastic surgery, plastic Mohs surgery. Let me tell you what Mohs surgery is. Mohs was a kind of surgery that was created by a Dr. Mohs. I think he was at UCLA, I'm not sure. And what they do is they take tissue from the growth, they take tissue, they then go into the lab and they look at it and they see, we've taken this much tissue off, is there any more cancer on the top, the bottom? Are the margins clear? They're not clear? Oh, then we need to do it again. Then they go in and they remove more tissue. Again, are the margins clear? Is everything gone? So that's Mohs surgery. So they don't guess. They take step by step and they go into the lab to make sure that all of the tissue is clean from the cancer. So I think I've had 35 or 40 removed from my face. I know I've had 3 around my lips, and I've had innumerable around my nose. A long time ago, well, I think must have been 40 years ago, we were driving home from Sun Valley, Idaho, skiing. Sun Valley is preeminent ski country. And it was 4 o'clock in the morning, and we'd leave early in the morning because we had to drive from not we didn't have to, but we were driving from Sun Valley to Los Angeles. And that took, I don't know, 13, 14 hours, something like that. So we'd leave early in the morning. We were all wearing our seatbelts. We were driving along, and suddenly the car skids on black ice and rolls off the road. They take me I'm the only one who gets hurt. They take me into the emergency room in Twin Falls, Idaho. An ambulance comes and gets us. And as I say, I'm the only one that's hurt. And the doctor asked me what that lump is in my throat. And I said, I don't have a lump. And he said, well, maybe you're not aware of it because you wear turtlenecks all the time. And I said, but I take showers. I'd know if I had a lump in my throat. Well, it turns out that it was bleeding into my thyroid. I come back to Los Angeles, go to see the endocrinologist, have all sorts of tests. They futz around with all sorts of medications. I have biopsies taken. But what they can't tell is if they see that the front of my thyroid is okay, but they can't tell if the back is. Turns out they decide to remove my thyroid because they're afraid, because of my experience having x-ray treatments as a teenager, they remove my thyroid. So I've had my thyroid removed, thyroid surgery. I've had any number of skin cancers removed from my face, my lips, my forehead. I've got scars here. I, my nose. My nose, I think, has had the most. Well, fast forward, I would see the doctor every 6 to 8 months, and every time I'd go, I'd always have something, and I always have to have something removed. And when I have something removed, I'm not allowed to exercise. They don't want my blood pressure going up. They don't want any pressure on the stitches so that so that it heals well. Because of COVID, I didn't go to the skin doctor. I didn't go to any doctors. And what happened was, I during COVID, I wait, it's this side. I would scratch my ear because there was some rough tissue there. I couldn't see it, but I'd just scratch my ear, and it went on for a period of time, and a couple of times it would bleed, and I didn't know. I thought, well, maybe you're scratching too hard, um, and I showed it to my husband. He says it looks like a pimple back there, so I didn't think more about it. Didn't dawn on me. Well, recently, a few weeks ago, maybe three, I went to no, it wasn't over a month ago. I went to the dermatologist. He took a biopsy of this. He saw something that looked like a pimple here. He took a biopsy of that. And this looked like kind of like a white wart, tiny one. He took a biopsy of this. Then calls me about 7 days later. The ear has a very aggressive basal cell cancer. This is negative, but this is positive. Call up and make an appointment with my Mohs plastic surgeon. Well, let me tell you kind of the procedure, what happens. You go to the doctor, usually maybe 9:30, 10 in the morning. You wind up usually spending the whole day there because they take tissue, then they have to take it into the lab, and the surgeon has a lab, and they look to make sure that all the margins are clear. That takes an hour or two. Then do you need to have another layer of tissue taken? Not sure, but there are other people in the office. They're having the same procedure done, and they have to wait also. So my suggestion, make sure you take a book, make sure you take your iPhone or your Kindle, because you're going to be spending the whole day there, at least many hours there. Does it hurt? When they have to numb the area, and you know what? It hurts. And especially there's so much cartilage in your nose, that one really hurts. But then it goes away because it numbs it and it goes away. But it hurts. This ear, because it turns out it was a very aggressive kind of basal cell cancer. They had to remove 3 layers of tissue, and it wasn't just little layers. They had to remove a lot from my ear. Pain afterwards, usually Tylenol can do it for you. I think it depends on where the pain is. This ear, that really hurt me for, I'd say, 2 or 3 days. This was the most painful I've had. Something to be aware of. I remember when they first put the bandage on, they don't want you to get water on it. They don't want you to do anything to it for usually 48 hours. So then your first look at it, it's devastating. You think, oh my God, what have they done? It is really atrocious looking. But time goes by, and it gets better, and it gets better, and it will heal. And if it doesn't heal, they do what's called revisions, because I know that there was an area around my nose that they had to do there. I had so many surgeries around there that they needed to do a revision, and it looks great now. I mean, if you look really closely, yes, you can see the scars, but who's going to look that closely at your face? Only you. So I wanted to also let you know that another woman who has talked about her experience with basal cell cancer, her name is Pat Sloan. She's a quilting artist, and she's on YouTube. And I'm going to put her name and also A woman from Mel's Kitchen also wrote about her experience. And if you're interested, I think that these are good, um, a good blog to read and a good YouTube to take a look at, because we've all had different experiences, yet we've all had, in a way, the same experience. And it might make, I think it, the more information you have, the better. Please wear sunblock, or wear a hat, a hat with SPF. Um, this just reminded me, when I go walking, I've been wearing a hat that's open on top. You know what? I'm going to stop wearing it. I'm going to start wearing a hat with a top, because they've been having a lot of skin cancers, especially on men, where it's been on the top of their head. So make sure that your husband, your boyfriend, your son, whoever has it, make sure that they check on their scalp for skin cancer also. I hope this helps. If you have any questions, please ask me questions in the comments below, and of course I will answer them. So that's what I've been through. I hope you, please, oh, you know me, I never remember to tell you to subscribe, to press a thumbs up, and to be notified, click the little bell. It doesn't cost you anything to subscribe, but you're just notified, and this way the algorithm knows that you're interested in my videos. So I'm sorry I can't smile. I know that you guys like it when I smile, but I can't. I can feel it pulling. But thank you for watching, and I'll be better soon. Truly, I will. Hope this helps. Bye-bye.